Good morning, Mrs. Lane. My name's Marthenia. I'm Dr. Park's nurse. How are you today?
I'm okay.
Okay, I'm gonna, first of all, I need your name, last name, and date of birth.
Land and 10/10/60.
Thank you. I'm just gonna grab your vitals, okay?
Mm-hmm.
Under your tongue. Your temp was 97.9.
Thank you. That's good. No fever?
No fever, not at all. That's perfectly normal. We're still waiting for your blood pressure.
Mm-hmm.
Your blood pressure was 133/99. Your diastolic was slightly elevated, but your systolic is fine, and your pulse is 81. That's fine.
Okay.
I'm just gonna put those in here.
Mm-hmm.
And what brings you in today, Joyce?
Oh, I've been having this headache.
What type of headache?
It's in the back of my head, and it's just been going on for a very long time.
Is that the only thing that's bothering you today? Is the headache?
Oh no, I've been having some numbness and tingling in my hands.
Okay. What I'm gonna do is make a list of all the things that you're telling me, so
Mhm.
that I can relay those to Dr. Parks when she comes in, before she comes in.
Mm-hmm.
Now, what I need to ask you is your headache. Is it on a scale of 1 to 10?
Mm-hmm.
10 being excruciating pain, 1 being mild pain. How would you rate it?
I would say it's about 5.
A 5 for the
Mhm.
headache, and does it radiate down your neck, or is it in one spot?
It's in the back of my head and goes to my neck.
Okay. And the tingling in your fingers on a scale of 1 to 10, could you rate that?
It's about a 2.
A 2? Okay, and is that when you're lifting items, or if you're just keeping your hands still? What?
Oh, when I go to lift something, I notice.
Okay. Now, in both cases, how long have you been having pain and symptoms?
In my head.
Yes.
My head been a very long time,
Okay.
and it's just been throbbing.
Okay. Do you have any paperwork or medication refills you need?
I do need my blood pressure medications.
Okay.
And no paperwork.
Okay, and what pharmacy do you use?
CVS.
Okay, thank you.
Thank you.
Hello there, Joyce. So
Morning,
good to see you
Doctor.
back. I'm
Thank you.
Dr. Parks again. So I understand from what Marthenia tells me that we have a couple things on our agenda today. In the computer, she wrote down that you have headaches and that you have some hand pain.
Yes.
Okay. Is there something else that's going on today?
Oh yes, I've been having this back pain.
Okay. All right. Is there something else that's going on?
Not at this time, doctor.
Okay. So let's talk a little bit about your headache. We've seen you in here for your headache about 5 or 6 times since you moved here from Cuba.
Mm-hmm.
Tell me a little bit about what's bothering you with the head now.
Well, it's just never to go away when I take medicine. It doesn't help. It's just that it stays in the back of my head. And I was thinking I may be having a stroke because my fingers.
Right. I hear that you're very concerned about the head pain. I seem to remember that we had a CT scan back from Cuba. Let me look at that document. Okay. So the CT scan read that things were normal, but we had talked about the word hernia in the past. Do you
Yeah.
remember that?
I do, doctor.
There was some wording in the paperwork of the CT scan suggesting that you had a hernia. What does that mean to you?
It means that the hernia is causing more, making me have this bad headache, and I think that could be why I think I'm having a stroke. And I just want to make sure, doctor, that I'm not having a stroke.
That sounds really scary. I can see why you'd be very worried about that. That's not the same information that I understand from reading the CT scan. I have a couple pictures here of a human brain, and I would like to talk about that with you so that we can compare notes on that, okay? Okay. Oh. You know, I know this is really important, but the hospital needs my attention for just a minute. I'm going to excuse myself,
Okay, doctor.
Hi, labor and delivery. Yes, this is Dr. Parks. So she's already 6 centimeters. Okay. And she's on epidural, and she's got a little pit running. Okay. Well, I'm in the middle of clinic. I've got about 2 hours left. Why don't you try to keep her on her epidural, check her in 2 hours, and if there's anything before then, let me know. Otherwise, I'll be out there around 5 o'clock. Thank you. Okay, Joyce, again, I apologize for that interruption. It was the hospital calling me about an important matter, but we were talking about your idea that you have a hernia that may be causing you a stroke, and we were just about ready to look at some pictures about the human brain, okay? So what I want you to understand is that your brain is inside a bone, that's your skull, and sometimes when we talk about the word hernia, we're talking about your brain tissue actually coming out of that bone, and that would be a very serious matter, but that's not what's happening.
Oh, so you mean all this for me looks okay?
It did look just fine, and there was no risk of that. They were looking at some of the bones in your spine, and they were looking at the spaces in between. They're called discs, and I have a picture of that too. We're going to just talk about how that might be part of the problem. So here's a normal disc between, and then here's a disc that is showing a little bit of herniation. Now when they're talking about the word hernia, this is not a risk for a stroke for you. Okay, this is some neck pain that may be caused by some of the tissue between your bones. I want you to be clear that you're not having any risks for a stroke.
Okay, doctor. Thank you. I feel better with the picture. Thank you.
And I've noticed that when you've been doing, you look so nice, you've been exercising, I can tell. When you've been exercising, I'm afraid that you might be pulling a muscle here that is causing you some pain that makes you feel like you're having more head pain, and it's not related to that. I really do not think so, but we're going to do an exam in just a minute.
Okay.
Okay. So we've talked about that. Was there something else besides the hand pain, the headache, and your back pain?
Yes, I've been having some clear fluid come out of my nose, and it just, for the last 2 to 3 days, I noticed it's been clear, and I just had some concern.
Right. Have you had any allergy type symptoms?
Sneezing a little bit, and sometimes.
Is that new for you?
That is new, and I'm just making sure that with my runny nose, the clear fluid, that again.
These are all things we need to check on. Could I do an exam on you today?
Yes, doctor.
Okay, why don't you have a seat up here? I'm going to listen to your heart and lungs. All of this is going to help us make sure that there's nothing going on with your brain as well. Okay? Okay, listen to your heart here. Okay, now both of them. Great, your heart sounds terrific today, Joyce.
Oh, great.
Okay, your lungs are clear. There doesn't seem to be any problem. I'm going to ask about your muscles here. Does one side hurt more than the other?
No.
Okay, all right. I'm going to have you turn your head all the way this direction and all the way that direction. Any pain there?
No.
Okay, I'm going to look in your ears. This is going to help us make sure nothing's going on inside your brain or behind your eardrums. Looks like there's a little fluid behind both sides. This would go along with the idea that you might have some allergy symptoms, and that's why your nose might be dripping a little bit, okay? Look out of the wall over there for me. I'm going to look inside the back of your eye so that I can see the back of your retina. That's talking about a part of your brain, and that all looks really normal, okay? I feel a little lymph node under here. Have you had any symptoms like besides this runny nose, maybe a little soreness in your throat?
A little bit.
Okay, that could be why maybe you're having some of the runny nose that's going on, okay? Now have you squeeze my fingers real tight, spread your fingers out and hold them out real tight. Excellent, okay. You know, your exam is very normal today. It doesn't tell me anything's wrong with your brain, and you haven't had a stroke.
Oh, I'm so happy to hear that.
You can have a seat down here. We need to wrap up our visit, and there's several things that we need to have you do over the next couple weeks.
Okay.
Again, I'm going to go back to show you some pictures. I would really like you to do some exercises that are going to help your neck muscles. Can you see this picture here? There's all kinds of neck muscles here.
Mm-hmm.
These are the ones that are a little sore. I'd like to send this picture to you and some reminders to do some exercises. Do you have an email?
I do. It's
Okay, I'm going to send this to you in your email. Go ahead.
jland
Okay, yep.
at jordanhealth.org.
Okay. All right, so that's going to go to you then. Perfect. Sounds good. And then I'm going to show you these exercises too. When you get this email, what's going to happen is that you're going to be able to see all the pictures that I have here.
Mm-hmm.
I'd like you to do this exercise,
Mm-hmm.
and this exercise here,
Mm-hmm.
and this one. They're going to all be in your email box, okay?
Okay.
Okay. So those are going to help your headache. For your hand pain, my suggestion would be that we take a little bit of Tylenol occasionally if you wake up with sore joints.
Okay.
The other idea that works really well is putting some warm water on them. So maybe doing the dishes early in the morning might really help you.
Oh, wonderful.
And then for the allergy symptoms that have been causing a runny nose, if they're very bothersome to you, we could put you on some allergy medicine, but it's really up to you because it's not going to cure the problem. Would you like to take another medicine?
Is it gonna help to clear?
It's going to help to clear discharge.
I think that will be helpful.
Okay, sounds good. Marthenia mentioned that you need your blood pressure medicine refilled, and I've done that for you, okay?
Oh, thank you, doctor.
We have covered a lot of things today. Would you mind telling me some of the things that we covered so that I can write them in your summary today?
Yes. So one, you're gonna send me some pictures in my email,
Correct.
and I'm gonna do those exercises. And how often should I do these, doctor?
What time of the day do you think you could do them?
Well, my day is pretty free in the morning. I have no grandchildren.
Could you do them in the morning?
I could.
Maybe 5 days a week?
What about 3?
Perfect.
Okay.
All right, let's do 3 days a week in the morning, okay?
Awesome.
Okay, I have the exercises down. What else are you going to do for your hand pain, for
And
instance?
for my hand pain, I'm going to. Do you mind if I take a few minutes to think about it? Because we went over a lot.
We did cover a lot of stuff today, Joyce.
So you said to make sure I take some Tylenol.
Perfect. How about if I put 325 milligram tablets in here?
Okay, awesome. And warm soaks.
Yes, perfect.
Okay.
And then for the allergies, what were we going to do?
You were going to prescribe me something.
The new medicine is called Claritin. You're going to take it once a day in the morning,
Okay.
and I've sent it over to your pharmacy already.
Okay.
Okay, wonderful. I would like to check back with you in 3 weeks. Would that work?
Yes. Perfect.
Thanks so much for explaining all this. I just wanted to review one more time. I do not think you're having a stroke.
Okay.
Okay?
Oh, I appreciate that, doctor.
Okay, your exam is normal, and we'll talk to you in about 3 weeks.
Thank you.
Marthenia is coming in with a summary that we just talked about. Okay?
Okay. Thank you.
Okay.
Have a nice day,
See you in
doctor.
3 weeks. Bye-bye.
Hi, Joy. Hi, Marthenia.
Here's your delivery summary. This details all of the things that were addressed in your visit today.
Mm-hmm.
Also, Dr. Parks relayed to me that it will be emailing you regarding any other issues you had today.
Yes, yes.
And also, she'll be giving you a phone call regarding your blood work, and you are to schedule a 3-week follow-up
Alrighty.
before you leave. Do you have anything else you need me to address?
I think we covered everything.
Awesome. Okay. We will look forward to seeing you again in 3 weeks.
Well, thank you.
You're welcome. Have a nice day.
Thank you.